At UT Southwestern, we are a very high-volume program for managing patients with pacemaker or defibrillator leads that have had problems that need to be removed. And the patient that we're going to show is a fairly typical example. This patient has had several pacemaker procedures in the past, one of which involved a lead that has now been abandoned for over 20 years, but one of his current leads is now dysfunctional, and that's going to be removed and replaced. We do over 100 cases a year, and we've been doing these for many years, so we've evolved an effective system for treating these patients. We're in a cardiac operating room. The patient is completely asleep. He's being managed by a cardiac anesthesiologist, and everyone in the room is trained for cardiac procedures. There's a cardiac surgeon available, in fact, doing the procedure most of the time, and our cardiac nurses are there. And this room also has imaging where we can get X-ray imaging of everything that's going on simultaneously during the procedure. We have a very strong focus on safety. In the unusual situation, if there was to be damage to a heart vessel or to the heart itself, we can immediately treat that problem to avoid a serious outcome. One of the safety things that we do is to place a wire called a bridge wire up into the heart. This enables us to place a balloon in the heart if there were to be a perforation to seal that, to give us more time to react. Another thing we do is we place temporary pacing leads. If the pacemaker lead is dislodged, we have a backup way to pace the heart so the patient's heart rate does not get too slow. In the actual lead extraction procedure, there are several steps. First, there's a locking stylet that's placed within the lead. This stiffens the lead and makes it available as a better platform for extraction. Then there's a specialized laser system that is used that goes over the lead that carefully breaks down any attachments between the lead and the vein or the heart itself that may have occurred over the years that the lead has been in place. Finally, when the lead is removed, we place a new wire inside that sheath, and this is then the access site for a sheath that can place a brand new pacemaking lead to solve the original problem that we're dealing with. After the patient has had the pacemaker system completely revised and tested, the patient is taken out to the recovery room. They typically can go home the same day or the next day, depending on the time of day and the length of the procedure.